Congress is doing away with the health insurance tax the end of this year. Now, some state lawmakers want to replace it with a health insurance fee. It would help subsidize care for people who can't afford it, including those in the country illegally. Political specialist Sean Boyd joins us from the Capitol tonight. And Sean, this is certainly a big deal.
And yet, Karen, it was introduced late yesterday and was in committee this afternoon before a remarkably small crowd. Insurers, brokers, the Colorado Chamber of Commerce and other business groups say they didn't even know about the bill that they say will raise health insurance premiums for employers and employees alike.
This is a complex subject.
Complex and controversial. The Senate Finance Committee took up a bill that would generate millions of dollars to help subsidize health care for those who can't afford it. The money would come from a fee imposed on health insurers, or what they call a tax.
The majority of this tax will be borne by employers who purchase health care for their employees, and therefore their employees will also be part of this tax, and they won't see the benefits.
Amanda Massey, head of the Colorado Association of Health Plans, says the bill will result in premium increases for 30% of Coloradans to pay for a state program that benefits 2 to 3%. The legislature set up a so-called reinsurance program to help people who live in mountain communities where premiums are among the highest in the country. The cost to the state, $60 million a year. The bill would generate $135 million.
Every dollar of that additional money is going to be utilized to make healthcare more affordable, to expand the populations that we can serve, to make sure that those folks can afford health insurance too.
That population includes non-citizens who could receive up to $35 million in subsidies. But Senator Jim Smallwood says the average family of 4 could see their premiums go up by $600 a year.
It's a lot of money that in this time, I think belongs back in the pockets of our hardworking citizens. All you need to do is read the bill to realize that this is a slush fund bill.
No surprise, the bill passed the Finance Committee on a party line vote. Governor Polis, who has made saving people money on health care the focus of his administration, supports the bill, despite insurers and others' claims that it would do just the opposite. This does have a good chance of passing in the democratically controlled legislature, but it is almost certain to also result in a lawsuit from those who claim this fee is just a tax. And in Colorado, that needs voter approval. Live at the Capitol, Sean Boyd covering Colorado First.
All right, Sean, thank you for staying on top of that one for us. Let's